for joining us today for Construction Crisis, Preventing Suicide and Substance Abuse. We have three panelists here with us today. Kaar, VP of Workforce Risk and Worker Wellbeing. Marko, Kaar, Director of Safety and Operations for Bartlett and Brainerd Eckhart, and Kyle Zimmer, Junior Director of Health and Safety and instructor for the International Union of Operating Engineers, Local 478. So I want to thank you guys for joining today to talk on a subject matter that is very prevalent in today's construction industry. So with that, I will like everybody to keep all your questions in the Q&A portion and try and minimize using the chat so we can use those for moderations. So with that, I'll turn it over to Kyle Zimmer.
Can you hear me now, Cal? Is that good? Okay, thank you. Well, good afternoon, everybody. As Alex said, my name is Kyle Zimmer. I'm the Health and Safety Director and Members Assistance Coordinator, Program Coordinator for Local 478 Operating Engineers in Connecticut. And I want to thank the staff of TAUC for inviting us today to talk about a subject that's very uncomfortable, and it's time to get comfortable, and that's lifestyle issues in construction that's affecting us all. A few years ago, I had the privilege, along with another co-presenter today, Marko Kaar, to come down to your health and safety December gathering in DC and talk about substance abuse, suicide prevention, and behavioral health issues. And at that time, the topics that we're going to talk about were still uncomfortable to talk about on the job sites, in the workplace, and we were losing people at an alarming rate. We still are. Although the dynamics, as we go through today's process, you'll learn about the dynamics of what's going on. The one thing that I am happy to say is that people are getting more comfortable talking about these issues. And once that happens, you see that the people that are struggling are more comfortable getting help. We're reducing stigmas. We're taking the stigma away from being blackballed on a job site, the stigma from taking away that you're going to lose your family, you're going to lose everything you have because we're talking. And one of the ways that we do that is through peer-to-peer engagement, which we're going to be talking about in a minute. However, we have a new normal to contend with. So before we get to talking about substances and suicide, let's talk about the new normal, and that's the COVID-19 issues that we're having. What we're seeing is that there's some issues happening on the job sites now with stress, depression, and anxiety that just naturally dovetails with the addiction issues and the mental health issues. So we're going to be talking a little about that and intertwining that through the presentation. So the new normal, we're going back to work. We have to, prevent germs, wear a mask, and social distance. And for the most part, it's working pretty good on the job sites from my observations and from colleagues around the country that we talk to, that is working. However, there's a lot of issues that are happening on the job sites that people are taking from home, bringing them to work, caring for the elderly, worrying about loved ones, providing homeschooling. These all build stress, and they all tend to come to the workplace with the workers. So we're just adding and multiplying what's happening on the job sites, the issues that we're being confronted with daily, and how to deal with it. And one thing that the experts have said, clinicians throughout the country, is what they're saying is it's relating to PTSD. A lot of the issues that are happening with the COVID-19s are showing the same symptoms as PTSD does. And here are some of the coping strategies that have been used for a number of years to deal with PTSD. And they're recommending it, a little bit of changes, but they're recommending that we use these for the COVID-19 crisis also. You know, connect with people. We can't physically spend a lot of time with people in large groups, but, you know, Zoom meetings, talking to people, social media wise, stay connected, stay connected. A big part of coping with the pandemic is exercise. Get out and exercise. Take a walk. I know personally, in my neighborhood, I've seen a very, very big uptick of people walking their dogs, walking with their children. And I'm sure that's the same for a lot of people that are listening in today. Get out there, get some exercise, take your mind off of things that are going on. Counseling. Counseling has changed a lot in the last few months. A lot of, again, the virtual meetings, the Zoom meetings. People that are struggling with substance use issues no longer attend support groups in a in-person setting, and they've been doing it virtually. And at first it was a big challenge, but as time goes on, people are getting used to it and they're very successful. So, you know, you can promote that type of help also. Journaling, write down your experiences, keep notes. Because when we look back on this is going to be a great learning experience for our children and grandchildren to learn from. Lifestyle changes, try to keep those to a minimum, keep good diets, try to limit any excessive intake of alcohol or any type of drugs that you may be taking. Just you want to keep lifestyle changes to a minimum and try to be as healthy as possible. So it's a vicious circle. Stress increases. Stress increases, employees avoid, cooperation ebbs, frustration ensues, and it's a vicious circle. And what this causes is one thing that I like to call is presenteeism, and we'll talk about that in a minute. But all of these things combined really, really fall into a safety issue for our workers, for our employers and our workers, our union members. A number of years ago, Marko and I were talking about how we can introduce the lifestyle issues as they are to the workforce and have them listen to us, because nobody wants to listen. It's not my problem. I don't have these issues. Everybody else has to deal with it. Well, sitting here looking at it, it really is our problems. It affects everybody. And we sat there and we said, we need a hook. We need to get the workers in the workplace to understand that this is a safety issue. And how do we do that? Well, you look at the Focus 4 that OSHA has had for a number of years. You have falls, struck by electrocution, and caught in between. And this is the basis of every OSHA 10, every OSHA 30 training that's out there. And we really had to change the culture. We had to look at what was going on in the job sites, people coming to work in an impaired state. How can we get them to relate this to a safety issue? So it was time to get uncomfortable, and it was time really to start talking about, is it time for the fifth focus? And that's addiction, behavioral health, and suicide. And over the past few years, we've seen an uptick in people really paying attention to this. And Marko will explain a little bit of what we've done in Connecticut with stand downs and things along that line. But it really is a safety issue. You know, back when the Focus 4 started, there were 12,000 worker deaths in construction a year. We've cut that down with Focus 4, and we can put those in the categories. What we can't do yet is how many deaths have been caused by impaired workers and the impact that it's had economically on both the companies and the workforce. So what is presenteeism? It's being there physically, but not being there mentally. And again, with the COVID-19 crisis, the pandemic that's out there, we're seeing the presenteeism really ramp up. People are concerned about their health. People are concerned about their loved ones. People are concerned about what's going on in society. It's a very difficult time to live and to function. But, you know, again, using the tools that we have from a peer perspective, where we can help our coworkers, let them know it's okay to have these issues and these feelings, and that we can work through it. We can address the presenteeism. You look at that worker sitting there 1,000 miles away. Anybody that's ever worked on a job site for any period of time has seen this look on somebody. Something's going on. Well, what is it? How do you unwrap it? How do you get them help? You ask a question. Are you okay? Is there anything I can do to help you? And you start the communication process. You start it with empathy. You start it with compassion. You start it with care. And you work through it. And you make sure you have a network of resources available, that the workforce has a network of resources available so they can get the help that's needed. So if you look at it just really in a simplistic form, presenteeism impacts on safety is the risk of having an incident at work, risk of becoming seriously injured or hurting somebody else, putting their lives and coworkers' lives in danger, and becoming a statistics. So we really need to broaden our awareness on what's going on and how we can help. The peer-to-peer concept, peer-to-peer support, has been around for years, especially in the organized labor world. And peers are provided with education on basic skills to recognize that there's an issue and how to deal with it. Peer training is unique, and peers are allowed to grow and develop their individual skills as needed. In Connecticut, Local 478, we do have a peer program, and right now we have probably around 12 operating engineers around the state that have had some training on how to recognize issues and how to steer people that are hurting and that are struggling to help network that they can access. And it's not only for them; it's for their families and friends also that they can use. So peers have been around a long time. Organized labor is a leader in using the peer support system through labor assistance professionals and other organizations around the country. The peer-to-peer approach works wonderfully. The next statement is so true. Union members are more willing to speak with another union member for the first contact when facing an issue. Anecdotally, we hear stories all the time that, you see somebody eating lunch by themselves. You go back to that picture in the previous slide, the guy just sitting there in turmoil. You go up to that individual, ask them, hey, you okay? Is there anything I can do? And that, for the most part, opens up a floodgate, plants the seed for people to open up and say, yeah, my kid's struggling, my wife's struggling, my spouse is struggling, I'm struggling, and it starts to flow there. So the 3 R's, as I call them, is you need to recognize, react, and recommend. If you recognize somebody that looks like they may need some help, you react. You go up to them, you talk to them, and then you recommend, hey, did you talk to your EAP, or, have you talked to anybody? What can we do to help? And you start that conversation. So effective communication is huge. And we all know this from being in the industry for a number of years, going on 40, believe it or not. I have seen communication change dramatically over several cycles in my lifetime, from, you know, the grumpy old construction worker to somebody that's today is being a little more compassionate and caring. And it all comes down to communications. It really does. And people like to be talked to in a calming, supportive, educational way rather than being yelled at, screamed at, ignored. It's just the dynamics of effective communication. You can get so much done and make a workplace so much better. So you have active listening. I turn my lights back on in my office. You have active listening, nonverbal communication. Asking questions is very, very important. Being clear and succinct, clarifying and summarizing, being empathetic, developing trust and rapport, providing feedback, being present, and please don't be judgmental. You're there to help the person, not to hurt them. And as Cal will talk about during his section, being honest and being trustworthy are the two most important things that we can do with somebody that's struggling that we're communicating with. We'll cover those a little bit as we go on. So the do's. Do frame the conversation as a health issue. When you do this, you remove the stigma, especially with substance misuse disorders. Anybody that's struggling with drugs or alcohol has preconceived notion of the stigmas that are involved with it. I mentioned those earlier. You're going to lose your job. You're going to be blackballed from whatever organization you belong to. And you need to frame it as a health conversation because addiction has been proven to be a disease. It's not a moral failing. And that's for both alcohol and illegal substances, drugs. So we want to have it as a health conversation. Use realistic, real-life examples. Do help individuals identify potential consequences, especially with employment. That is a very important issue that they do have a lot to lose. And a lot of times when people are struggling, they can't see the forest through the trees. So you need to point that out. One thing that I learned early on when I took on a peer role is the person that's struggling is usually the last person to know that they have a problem. So keep that in the back of your mind when you're talking to these people. Do engage peers as messengers. That's especially important for employees to remember that sometimes you want to get a message out to the workforce, use the peers. Again, union members talking to union members, workforce to workforce is the best way to communicate. Do not de-glamorize substance abuse. You know, you can't condone it. You need to listen. You need to talk to the individuals that are struggling and reach common ground. Don't lecture guilt or shame. Nobody likes that, especially when you're in a crisis situation. They're there for the help. They're not there to get lectured. Don't encourage sensation seeking. Don't try to outone them with a story. Don't use scare tactics and don't illustrate or dramatize drug use. Some of the barriers to effective communication that we've come up with is once you start talking to people, you'll find out they're dissatisfied or disinterested with one's job. We need to take that into consideration, start to talk to that. Their inability to listen to others. Sometimes it's a long, arduous process to get somebody that's struggling to listen, to accept the help. But, you know, as a peer, what we try to do is we try to plant the seed so they know that there's help there and that they know where to go when they decide to seek that help. Lack of transparency and trust. If you break that trust barrier, the person that you're trying to help is just going to turn off to you. Communication style. Not everybody can talk to everybody. So if you're having a conversation with somebody and you feel it's not working out for you, you may want to back away and bring somebody else in. That has happened to me several times, and You just need to go, this is for the best of the person that's struggling. I can't deal with this one. I need to bring in somebody else. Conflicts in the workplace is another issue that you could have a barrier with to effective communication. You need to have your eyes open to what's going on in the surroundings, whether, there's internal politics in a company that's, stifling this communication or whatever, but you need to look at it, evaluate it, and come up with creative ways to overcome it. And then cultural differences in language. Obviously, we have diversity all over the workforce now. It's very, very good, but sometimes cultural differences and language barriers can put up a wall. And you need to, again, understand that and to bring in people that can help you break down those barriers and language issues. So what we're going to do is we're going to do a little bit of polling questions. Has your organization seen an uptick in relapse of substance use disorders by workers during the COVID-19 pandemic? Again, we've seen that happening, and there's some documentation out there, but we'd like to poll you and see what the results are.
Kyle, while we're waiting for participants, a question came in the Q&A from an anonymous attendee. It's clearly time for our industry to develop this or these issues as Focus 5. What steps do we need to take to make this happen, and how would we encompass the issues discussed? Thought that was a great way, a great intro to a quick conversation while we're waiting for the responses to come through about, what are some concrete steps that we can do to establish Focus 5 as a concept that everybody's talking about?
Well, I know OSHA was looking at it, and they were entertaining adding the fifth focus, and again, that was before the pandemic hit. So where they're at with it now, I was talking to some people at OTI. They like the idea of it. So we need to recircle back with them and see what they're.
The former Region 1 administrator, who Marko, you introduced me to a few years ago, he moved to DC in a deputy director role. I think he has an interest in it. Personally, I prefer a voluntary approach to a regulatory approach. If it becomes regulatory, I'm afraid it'll be watered down. Whereas companies that understand the importance of this and labor unions, I believe they'll take more action than a minimum standard. So that's room for conversation, and we can continue the dialogue at the end of our presentation too.
Awesome.
So Kyle, you got some results.
Yes, we do. So 45% are unsure that they haven't seen it. And Cal, you may want to talk about this on some of the research that you've been looking at the last couple of days. It's finally coming out, because we really don't know if there was a measure of relapses during the COVID-19 until very, very recently. So Cal?
Yeah, Marko has some really current updated slides. So I think I'm going to save that for you, Marko, because I think that's really a big part of our conversation today. One thing that's been interesting that unsure, I think, is concerning, because it still is something hidden from view. I call it the elephant in the room, and it's time for us to talk about it. And many companies are still afraid to talk about it. And so Marko's going to have real current information. I think it's relevant, though. It's real. And I think you'll be surprised, folks, when you see some of the data that Marko will be presenting.
And I guess another way to look at it too is, if we're unsure, we're probably not asking the right questions or having the right conversations. And I don't mean that to be critical in any way, shape, or form, but just to recognize the fact that when you see these numbers, and the article from the Washington Post that just came out, speaking to the tremendous increase year over year of overdose deaths, and other issues associated with mental health. I think now is a really good time to start asking ourselves, going back to the question about the Focus 5, certainly COVID is yet another reason for us to start, really getting involved in these conversations.
And one last comment, and then we can move on, would be this can also be family members. What COVID has done is really disrupted the family routine. So it may not necessarily be the worker, it could be their family members. And that's an area where the three of us have spent a lot of time. How do you provide the support to family and dependents affected by COVID as well?
Yeah.
So question number 2, we have another polling question. Which substance of choice appears to be more concerning for the workers' risk of relapse during the COVID-19 pandemic?
Hey, Kyle, while we're waiting for that, the survey to come back, or the poll to come back, I got another question that popped in, and maybe Marko and Kyle can answer as well. Can we speak to the need or not to maintain confidentiality when having sensitive discussions with an employee in distress?
Again, that falls under, in my estimation, the trust factor, that it goes no further than the two people that are having the conversation. But yeah, confidentiality is big in this, and as soon as that's broken, communication shuts down on a regular basis.
In some regards, that goes to the comment that Kyle had about recommending getting people referred to an appropriate source that can maintain even higher degree of confidentiality. So an employee assistance program, a member assistance program, a trusted advisor, using a helpline. And Marko is going to have information about a SAMHSA health helpline specifically for this area and helping people identify treatment sources. But great questions. Please keep the questions coming. And Kyle, I see you have the results.
Yeah, and not surprisingly, alcohol use is at 56%, followed by opioids at 12%, non-opioid substance 0%, and all substances equally 20%, and not sure or no opinion 12%. Alcohol obviously is very easy to obtain. Package stores didn't close down during the pandemic, during the times of stress, people that social drinkers, what's termed social drinkers, may have escalated their use of alcohol a little bit, and then people that are in recovery, I know for a fact have started using again alcohol, especially during these trying times.
And it's such a mainstream thing too. I mean, a lot of companies, I've read articles and seen pictures and whatnot, but a lot of companies are doing Zoom happy hours, so yeah. I guess we'll segue to that after this meeting. But it's so mainstream, it's so acceptable that people don't even think twice about it in many regards. If you don't spend a little bit of time thinking what's going on in the background, it's a joke to talk about it's 5 o'clock somewhere or it's noon somewhere, but it's not funny when you look at the numbers, especially in the construction industry. We joke about things that are uncomfortable, and that's something we need to be paying attention to.
Yeah, one of the biggest jokes during the pandemic is day drinking for people working from home, things along that line. So.
Yeah, I think you're illustrating, guys, that before COVID hit, our industry had an issue with alcohol dependence, substance use, and mental health and suicide, right? And we're trying to shift people to this concept of well-being and promote wellness, safety, and health in our safety culture.
Marko.
Oh, it's my turn.
It's your turn.
I just want to go back real quick to one of the comments regarding being unsure of what's happening out there. The thought process being that many people aren't back to work yet or back visiting projects. And I think that's very true. I know I was working from home for 9 or 10 weeks. I don't know, it felt like much longer. You know, getting back into the field and getting back in contact with the guys and girls on the job site is something that is critical. I think for us to be successful from a safety perspective, we have to be out there touching and feeling the job sites and the personnel on the site. We've got to be aware of what's happening around us and around our jobs. Let me see if I can share now, get onto my portion of the program. And then bring back up this screen so I know where I am. All right, so my name is Marko Kaar. I am the Director of Safety Operations for Bartlett Brainerd ECOT in Connecticut. We are a general contractor construction manager, work primarily in Connecticut, down as far as Maryland. We self-perform carpentry work, demolition work, concrete work, lots of different finish type operations, and then we subcontract a great deal of our work as well. So we've got a broad exposure from our own employees in the field to subcontractor employees as well. I've got 31 years in safety, about 36 years in construction. And I can tell you that there isn't a day that goes by that I am not confronted with how important it is to communicate. I think that that Kyle's slide about the 9 effective components of communication are really critical. Not just in terms of this soft subject that we have right now that we're talking about, mental health and suicide and substance abuse, but getting inside people's heads. Cal, you referenced Tim, who's down in DC now, talking about he helped start the OSHA webpage on suicide awareness. And I remember talking to him 5 or 6 years ago, and he talked about the number of suicides that had occurred in Massachusetts on job sites, in the workplace. And that made me start thinking, as I started walking around our jobs and other jobs, that there's something else going on. There's an undercurrent. There's always that component that people bring to work with them that Kyle refers to as presenteeism, that most of our workers are not fully engaged in the work process that they're performing at any given moment. And I think that's part of what we as safety people, safety individuals, safety directors, whatever your title is, we've got to be cognizant of, and we have to pay more attention to. I know for a fact that over the years, I've transitioned from a compliance guy to a team guy. And I keep trying to do that. I keep trying to focus on recognizing, what these issues are that people bring to the table and why compliance isn't as easy as we might think it is. We have to understand the distractions that occur on a daily basis. And we will speak, again to the fact that coronavirus, and somebody brought this up in the Q&A as well, what issues does the coronavirus bring to our job sites? What are guys talking about? What are girls talking about on the jobs? Yes, there's a constant conversation about masks and whether they work or they don't work. Here in Connecticut, it's a little bit different for us. We were very early in the surge of coronavirus. We've already lost 4,300 Connecticut residents to COVID-19. So our conversation really started in earnest a couple of months ago, and kind of eerily, scarily, we're on the backside of it now. Our numbers are looking great comparatively, compared to March. But we're looking at right now, our governor has a prohibition against entry from 19 states from around the country. If you want to come here from Kansas, you have to quarantine for 14 days. So there's an absolute amount of conversation that we've got to be aware of on our jobs that's happening in the background. I think that's critical. I was tasked specifically to speak to substance abuse and some of the numbers associated with that and some of the resources that are available out there. And the numbers are changing, and I think one important point to make is that the government numbers lag what you see in mainstream media by a year or two. Cal, thank you for putting this program together. You did a great job capturing a lot of the most recent data. But I think what's important is we can't wait for BLS to catch up. We've got to be reading the New York Times and the Washington Post and the LA Times and the Peoria Gazette or whatever it is locally. And we've got to see what numbers are happening on the ground right now. And we've got to respond based on what's happening now. We can't wait for the government to catch up with the numbers. I think when it comes to substance use disorders, it's important to recognize that anybody that does become addicted, it's not a matter of choice. Certainly there's a conversation about addiction being an illness. It is an illness. It is something that needs to be dealt with from a medical perspective. There's always a conversation about making the choice to drink. When did you start? Why did you start? But that switch over to addiction is not a choice that's made. And I think it's important to recognize that it is a chemical dependence. It's a physiological dependence that we have to be aware of, and we've got to treat. We've got to be aware of. It's important to recognize that, especially in the construction industry, with our higher rates of illness and injury, it's only normal, if you will, quote unquote, to self-medicate. It's only normal to go to a doctor and get a prescription for pain meds if you've suffered some type of an injury on the job site. With our rates typically being twice the national average for all other forms of employment, it just kind of goes without saying that we're going to have twice the opportunity to either self-medicate or to be prescribed prescription medications. So there's an automatic doubling, if you will, of potential exposure. And part of the problem with addiction is that it can be you can be genetically predisposed to it. You can be environmentally predisposed to it. Living in our construction culture, there's a tendency, the tough guy attitude and the hard drinking, hard driving attitude are the stereotypes that we have. And there are certain expectations of behavior associated with that a lot of us fall into the trap of. So I think we need to be aware of that. We need to be aware of what are called comorbidities, especially with alcoholism and many other forms of addiction, but alcoholism most particularly being as it's such a common problem in the overall population. 10% of the United States population has some type of an addiction, statistically speaking. And alcohol is one of those most common methods of delivery. Comorbidities are other types of diseases that go with or are accompanied by alcoholism. And, it can be bipolar, it can be schizophrenia, it can be anxiety, it can be PTSD. So a lot of times it's not enough just to quit drinking. You have to treat the comorbidity along with it. And I just saw some numbers the other day, 54 to 87%. And again, it's hard to define when you're talking about mental health, but somewhere from 50 to 80% of people that deal with alcohol abuse or alcohol misuse are also dealing with something else. So it's not enough just to quit drinking. You've got to see a doctor. And that takes time and it takes effort. The problem being is that there's such a large percentage of people that don't seek either because of the stigma attached to it or the time associated with it, or they can't get a sitter, or now, again, with COVID being the problem that it is, you can't go to a meeting. That's the number one thing, for an alcoholic is to say, go to a meeting and be with others and speak with them and talk to them and share. And if you can't do that, there's a potential for relapse that we need to be aware of. So, again, it's like a perfect storm right now with what's happening with COVID and substance abuse and substance misuse. Over time, over the past 3 to 5 years, and again, the numbers aren't caught up to 2020, but you see basically that the run is upward. 13.2% increase in overall drug use. We have the highest rate of cocaine use compared to the national average. Methamphetamine use has risen by 20%. And again, you know, the comorbidity. We have some type of a substance problem, but we're also dealing with depression. We're dealing with anxiety. And what is construction except for anxiety producing? We go to work every day, not knowing whether it's going to rain, whether the sheetrock's going to show up, whether the crane is going to be in place in time. Every day is anxiety that we deal with. And we take it as normal. It's a normal exposure for us. But it's part of what we do, and it's part of what we have to recognize as, you know, again, from a safety perspective, our jobs are, we are at risk on a daily basis to the mental health challenges that exist in fully 20% of the population. From a statistical perspective, if you look at drug overdose statistics, Kyle and I started speaking about this a couple of years ago. We came down to DC and spoke to TAUC. And at that point in time, the numbers were ugly and increasing. Certainly there has been a tremendous amount of focus on prescription drug use and overprescription, a glut of supply, abuses by big pharma. There's a whole bunch of focus that's been paid to this. And a lot has been done on the medical side in terms of looking at other ways to manage pain. So thankfully, if you look at the statistics from 17 to 18, you see a reduction in overdose deaths, which is great. We're gaining traction in regards to the fight on drugs. That doesn't mean we're safe though. It means that things are changing out there, that the exposures that we have, the types of drugs that are in place now are changing, and they're having a different effect on us. If you look at over the past couple of years, 16 through 18 or so, prescription opioid overdoses have gone down slightly. Again, more control, more government oversight, more notoriety to the subject by folks like us and folks like you out there in the industry that are paying attention to this. But what's happening is there are synthetic opioids that are being brought to the fore. Fentanyl is increasing in use. It's very affordable. It's very cheap. It's easy to mix with other drugs. So we're seeing overdoses related to fentanyl use because it increases the high for short money. And that's what people are chasing, is spend as little as you can to get as high as you can. So we're seeing those numbers increasing. From the perspective of COVID-19, what we've been talking about, to this point is that it is a big issue. People who have been in recovery for a period of time have never been through anything like this. I think it's fair for us all to say, except for the octogenarians in the group, that nobody on this call has ever been through anything like this in their lives. If you add to that the fact that you or a loved one may have some type of a substance abuse challenge, you take that normal day-to-day stress and you add to the fact that I can't speak to my group, I can't get out for counseling, I can't get my medication, there's nobody to talk to, the news is all bad, I can't watch CNN anymore. There's a tremendous amount of pressure on people who are in recovery. Relapse stories out there are scary. There are guys and girls who've been in recovery for 20, 25 years, and based on the stressors that are out there in the workplace right now, they're falling back, and it's a very difficult place to be. I want to point out, let's see if I can switch my share to this screen, which is some articles. There's an article that we're going to be putting together, a one-pager that Alex is going to send out as a follow-up to this program. There will be some links to it, but some of the things that are available out there is the Post article that I referred to that came out on July 1st, talking about some of the numbers associated with overdoses during the coronavirus pandemic. The slide program talks about some of the available toolbox talks. The Construction Industry Alliance for Suicide Prevention has a page of a number of different toolbox talks that are available out there. You'll get a link to these that you can print out, you can review with your employees on the job site. You know, again, I think one of the questions that came up was, what can we do? What steps can we take? And I think you can see that CIASP has been doing this for a number of years, and they've been putting together resources with Cal's help and others throughout the industry and across America. So there's a great deal of stuff available. We'll send you this link. One of the links that is on that page is a discussion about mental health and well-being during coronavirus COVID-19. Again, when you speak to people, you want to be specific. You want to relate to what's happening now. I kind of relate it to, you know, the standard toolbox talks that we used to do 20 years ago. When you would get the safety meeting toolbox talk subscription, they'd get sent to you on a monthly basis. And on June 19th, you'd be speaking about working in the cold. Or you'd be speaking to a group of painters about acetylene safety, because that's what came out that week. We need to be specific. We need to address the issues of the day right now. We need to be talking about this. So this resource is one of those resources that's available in the links that we'll be sending out to you. Switch back my share. Now we should be back on the slide program. One of the items referenced in the Post article is the dramatic increase of overdoses from last year. February to February, 16% increase, April to April, a 29% increase in May, when it was really ugly up here in the Northeast, when New York was suffering. I forget what the numbers were. It was 1,000 people a day were dying in New York. It was really, really ugly. And those numbers were really, really bad in May. And I think we're going to see this continue throughout the course of the summer. If the numbers are, you know, if they continue to be what's being predicted and what we're talking about now, it's not going to slow down. This is something we have to pay attention to. You know, again, one of the first questions that came up in the presentation in the Q&A was, is COVID playing a role? Absolutely. We need to be aware of that. We need to be talking about this. We need to be looking at the mental health effect that COVID is having on our workers. Think about the people that have been isolated from work. Reach out to the people that have been laid off. If you've got people on furlough or on layoff that you expect to come back, try to understand what they're bringing back to work with them when they come. Understand the challenges that they've had with financial resources over the past couple of months. Try to understand what you can do to help, what we can do to bring them food if necessary, bring them whatever sustenance is available out there. Recognizing that, you know, from a user's perspective, a substance user's perspective, that since they can't get out, they are finding the suppliers that are available to them. They're perhaps working with people who aren't trusted anymore. It's a weird situation. You know, depending on your point of view, your perspective, there's lots of ways to look at it. But one of the care methods that some states employ is to assist drug users with clean kits, fresh syringes, recognizing the fact that we have to develop that relationship. We've got to be, as Kyle talked about, you know, you've got to develop that level of trust. We can't realistically expect people to go cold turkey. It's not that easy. So part of what we need to do is we need to try to understand where they're coming from and what the relationships are that we can develop with them. And part of what, again, some states do, you know, agree with it or disagree with it, however you like. But, you know, the fact is that there are states that are providing these kits to users to at least help them use safely. That's part of what we need to be looking at. I don't know that it's the answer, but it's something that we need to be looking at. We need to understand what's happening in our locale, what's happening in your state, what programs are available out there to really bring people forward, bring them out of the shadows and engage them in conversation, engage them to the point that we can say, look, we know you have a challenge. We want to help. We can get through this through a step-by-step process. It takes time, it takes coordination, it takes communication. But it starts with recognizing the problem that we have. Again, there are any number of resources available out there. SAMHSA has a national helpline, 4357-662-4357. You can get help for rent, you can get help for mental health issues, you can get help for drug abuse issues, alcoholism. Pretty much you pick up the phone, you call them, and you express to them what your fear or your concern is, and they will put you in touch with the right resource. It's a great helpline. It's, you know, it's kind of a one-size-fits-all phone number. National Safety Council, many of us are members of the council. They have a great series of kits and information available that you can download and use. Again, toolbox talks and other resources for training, posters, et cetera, to help raise awareness. Something to think about. You know, there has been a transition over the past 10 years or so to AED use on the job site. And I think most of us have at least one job with an AED on site. And we are looking at that being, you know, a primary response source. You know, one of the tools in our toolbox, if you will, of our ability to respond to an emergency on the job site. If you look at the statistics, if you look at people coming back to work, if you look at the fact that relapse may have occurred, maybe it's time to start thinking about whether or not we have naloxone on site as well. There's a short training course associated with how to use naloxone. You have to be trained, and again, state by state rules and regulations are a little bit different. We do not stock our sites with naloxone. I carry it with me in my truck just in case. I don't know that I would be the first responder based on proximity to a local job site. And it's a scary thought to think that you might have to use it, but it is a lifesaver. It's certainly something that I would recommend that you at least take a look at and see if it's available to you locally. Polling question. One of the things that Kyle and I did back in October, November of last year, we worked with construction organizations here in Connecticut. We kind of piggybacked off what Massachusetts had done, and we started a stand down operation through the course of a week. We got the governor involved, we got the attorney general involved, multiple contractors throughout the state. I want to say it was over 3,500 total attendees to the various stand downs. Here at BB&E, over the course of a week, we had well over 500 attendees at our stand downs. And something to think about. So the question is, would your construction organization support the need for a national stand down on opioids for the construction industry?
Alex, there's a great article that features Kyle and Marko that would probably be a good link to send to the members who are attending today of TAUC. I think they'd appreciate seeing what these guys led. A really excellent effort. And I hope we'll see more states follow suit.
I'll send you a link to that, Alex. Construction Magazine, CONN Construction Magazine has a series of articles.
Okay, yeah, I will make sure. And to everybody out in the audience, like I said earlier, there will be a post survey, and then I'll also attach all the references that these guys are mentioning in that as well with that.
Awesome.
That's fantastic. 86% support the call for a national stand down on opioids. I think the model that you guys followed in Massachusetts and then Connecticut, I know we've had people in Oregon talk about wanting to do something similar in a couple Midwestern states. So kudos to you guys for taking the lead on such a life-saving initiative. Deep respect.
I tell you, it had a profound effect on me as I went through it through the course of the week. Not so much, I mean, at one point in time, I think the largest site stand down we had was about 115 personnel. And it was, it's a talking head thing. It's one guy talking about what's happening and, why we're focused on this and whatnot. But afterwards, having people pull me aside and say, wow, man, thanks for talking about this. I've been in recovery for 11 years and, this is something we need to talk about in construction. Because we talked about not only opioids. Opioids was kind of the door opener to the whole conversation about mental health and suicide. I had another guy come up to me and say, my brother took his own life about 9 months ago. And he said, it's so hard to talk about. I'm afraid to talk about it in the construction industry because I'm afraid I'm going to cry while I'm talking. But I obviously need help getting through this. I'm still trying to get through it. Having those conversations after the fact and understanding the emotion that's running through these workers on a daily basis, the stuff that they deal with, and to have somebody come up to you afterwards and say thank you, it was tremendous. And I know, and Kyle, I think you can attest to this, as part of the stand downs, actually having people get involved in recovery as a direct result of those meetings, coming up to you and saying, Kyle, I need to talk to you. You're on mute, Kyle.
I had personally, I had 3 people come up after the presentations and start the pathway to recovery, start asking the questions. So yeah, it was well worth it. We probably hit, I would say during the course of the week, maybe there were probably close to 100 stand downs done in Connecticut during those 4 days.
That's awesome.
And this is, on the slide program, there's a picture of, this is the 115 person stand down that we did. We will share resources on that as well. I'll get you, Alex, I'll get you the link to that article so you can find more information about it. Next polling question. Have you addressed substance use disorders and opioid overdose prevention with toolbox talks and training? Have you done this already? Is this an ongoing conversation for you? Or is it new? Very curious to hear what you've done.
And Marko, while we're waiting for some results to come back, here's a question that came in from Michael Dawson. What liability does a peer company take on if they do not immediately remove an employee that has made it known that they are struggling with either mental health or stress issues in an effort to protect that person's anonymity? Recognizing that job sites can be their own little soap opera at times, how do you address the clear safety issue with not outlining the worker involved?
That's a really hard question. I'll try throwing an answer at it. And I would say, Kyle, you've probably had more interventions than I've had, so you can probably speak to it more directly. But I would liken it to the thought process that goes on in your mind when you identify a safety issue on the job and you try to decide between strict enforcement. Is it an enforcement opportunity or is it a learning opportunity? And that's part of, I think, what we struggle with as safety professionals in the industry is what's the right balance of having a conversation with a guy or a girl on the job and introducing them to the concept that you want them to understand as opposed to sending them home or writing them a ticket. I think we need to be prepared, and part of our preparation perhaps is to go to perhaps a mental health first aid training class to have a better understanding of what the rules and regulations are in terms of confronting somebody. I think it's important to have drug and alcohol awareness training for all of your superintendents, all of your leaders, anybody in a leadership role, labor foreman, carpenter foreman, anybody that's in a leadership role should have drug and alcohol awareness training so that they're aware of the proper presentation style to affect when you are talking to somebody. And just as a quick aside, you know, there's a fabulous number of resources out there available. If you look for DOT drug and alcohol training, that's a great introduction to what superintendents and leadership should know. And you can find a lot of free resources out there. So that's kind of a shortcut to training of what you need to do when you speak to somebody. But Kyle, let me pass it over to you for more.
You were right on, Marko. Reasonable suspicion training has really become prevalent with contractors over the last few years. Teaching middle management people in the field on how to recognize signs and symptoms and how to deal with it and how to address it. And then, you know, you're protecting the assets of your company, and you're protecting the assets of the labor force by addressing it and doing so. And, you know, I've done several interventions and again, getting good at them, practicing them, coming up with a game plan between the people that you do it with, all add to the success of that. And to be quite honest with you, we have not, the ones that I've been involved in have all gone successful, and there's never been an issue with it. And again, going back to my statement earlier, usually the person that's struggling is the last one to realize that there's an issue. So, you know, again, I would recommend that you go to your legal people, your legal staff, and see what they say and follow their guidelines. But overall, interventions on job sites have been going very well, you know, countrywide lately.
And Marko, thanks to you, I got a chance to work with Kyle. I had been working for a signatory contractor for the past 6 years. And the first thing I did when I was rolling out behavioral health was went and met with our largest labor unions and had conversations about these very topics. And Kyle and I had the chance with the operating engineers to do some joint training. Here in the Northwest, the laborers have done similar things, and I've been a big part of partnering with them on that. What TAUC brings is that sophisticated support, and I think your publication was one of the first to cover opioids. The fact that you're covering this topic again as we're doing so today, I think there's ample opportunity. But I think the other workers on the job site won't take your safety seriously if you don't address that issue. Exactly. And doing so with dignity and respect and being responsible and reasonable, it sends a message to everyone that we really are a zero tolerance. And the beautiful thing about working with labor is we've got that last chance agreement built into most collective bargaining agreements. And I've seen that change lives. And I encourage non-union contractors to embrace that from collective bargaining agreements. And it's been a game changer. So I give a lot of credit to the labor movement for the actions that you're taking to meet management and make it a joint labor management success. So I'm glad we took that question, guys.
Yep.
So Marko, do you want to comment on your results here?
Well, let's see, what do we have? Has your construction organization addressed substance use disorders and opioid overdose prevention with toolbox talks and training? And it looks like about half have done some type of outreach or training, which is good. You know, certainly if you look at the statistics, it's not a question of if, but when at this point. So certainly, just as we talk about fall protection on a daily basis on our jobs, I think we should be talking about mental health awareness pretty much on a daily basis. So hopefully the resources that TAUC is going to put together based on our conversations here and some of the links that we've provided will give you all some more tools. Certainly, I'll speak for Kyle and Cal. These two guys have the biggest hearts available, and they've got huge libraries as well. So if you reach out to any of us, we're more than happy to provide you with an overwhelming amount of information to get you going on this, on this path. So, a lot of it may have to do with, the fact that we haven't done training or outreach at this point might be not knowing where to find resources, we are going to take that excuse away from you over the next couple of days. Cal, you're up.
Thank you, Marco. I'm going to go ahead and take over with my screen. So thank you very much. Appreciate that opportunity. And it is a pleasure to work with you two guys. I think you both have brought so much to this conversation. And as a partner of yours, it's been thrilling to see the success on the opioid issue. I appreciate when I was invited to go to TAUC in December that you guys went and covered in my place. And I just am grateful for the partnership that we've had. So the topic around mental health, suicide prevention, it's one that's gotten a lot of attention. In March of this year, March 16th to be exact, the day most companies across the country went virtual, having people work at home, I started a new job. I left the contractor I'd been working with for the past 6 years and took a job as the Vice President for Workforce Risk and Worker Well-Being. And I wanted to do so because I was feeling we had done so much work in the suicide prevention space. We were missing the opportunity to do more of the prevention work, those lifestyle issues that Kyle talked about, those job stressors that Marko talked about. And I was looking for a way to move from firefighting suicide prevention back to traditional safety, health, and wellness, where we baked behavioral health in to our daily safety culture, programs, and practices. And that's where I went to Lakeside Industries here in the Pacific Northwest with a vision of baking in behavioral health. Suicide still is a pressing public health concern, over 48,000 deaths in 2018. We expect the 2019 numbers to come in probably in the next 5 or 6 weeks. But the reality is we knew construction was a high-risk industry before the CDC had data. So to Marko's point about data always being lagging, and we knew that because we know our people. So by making this a safety topic, people who work in the field on project sites, working jointly with labor management, we understood that there were a whole host of factors. So industry factors, demographic factors, a lot of that would be the age. Younger workers are now reporting to be the loneliest workers. For many years, when Kyle and I were growing up in the industry, it was the older workers who were feeling more lonely. And now there's research that shows it's the younger workers, 25 and younger, that have the highest degree of loneliness. So it is keeping this relevant, and it's boiling this down into useful talking points. And so I really appreciate how Marko and Kyle want to share resources. I spend a good part of my day, every day, monitoring various publications, really digging in deep now on the substance use issue, because those factors like distraction are causing near hits, and near hits are leading, unfortunately, to serious injuries and fatalities, but they're also leading to quality issues and leading to rework, loss of productivity, and it's affecting the overall performance of our industry. So the most important message on my part of this conversation is that suicide can be preventable. And I want you to know about 20% of adults will experience a diagnosable mental health condition or illness in their lifetime. And that number will change year to year. So you'll have different people every year experiencing some of those conditions. The question about did COVID have an impact? Yes, it is exacerbated or worsened or deteriorated all of the existing anxiety, depression, and substance use. I think what's sad, only 20% of people with mental illness will seek help. And Marko said 10% with substance use. The reality is with mental health overall, early intervention, getting early treatment is the key. There can be up to 80% success with early intervention. And sadly, the NAMI, the National Alliance of Mental Illness, will say there's a gap from the onset of conditions to getting a diagnosis of 11 years before someone starts a proper treatment protocol. So by the time people get to the workforce, these issues could already be manifesting. Depression in the last generation the average age of onset went from 32 down to below 30 years of age. So there's a lot of things that we have to consider. I want everyone who hasn't already done so, load these two numbers into your phones. There are two crisis hotlines. One is crisis text line. It's available 24/7, 365. It's free, confidential, and anonymous. That number is 741-741. You can text help, connect. You can text anything. And when you send a text, you'll get a text reply. And they'll tell you that your message has been received. You're in the queue. They're going to identify a counselor for you to connect with. This was one of the most important tools I used at Lakeside. We started handing out wallet cards, and we distributed those like they were candy on job sites. We shared them at toolbox talks. We wanted people to know that this was a trusted source. The second group is the National Suicide Prevention Lifeline. That is like the granddaddy of all lifelines. In 2 years' time, we'll have 988 as a 3-digit call number, and we'll have consolidated all of this information. It needs to pass through Congress, but the approval is coming, and we're really excited by that development. In the meantime, 800-273-8255. And even if someone isn't feeling suicidal or that they're going to engage in self-harm that day, make that referral. They have the best network of resources and counselors available. There have been times where folks like me and Kyle and Marko have tried to help somebody using a traditional healthcare approach or an EAP approach. And it could have taken 2 to 3 weeks or more to get a counselor appointment. There have been times where both those organizations have been able to help somebody same day or next day. So they can both be lifesavers. In the event any of your operations are in Canada, I've been sharing the information for Canada as well. Crisis Services Canada has been the best source nationally in Canada, 833-456-4566. And really happy to announce that there is a Canadian version of Crisis Text Line. Here you type connect, and it's 6868. And that's a really important number to remember. So I want to just go quickly. What's important to realize about suicide is it is the 10th leading cause of death for all ages. And among men, it is our second leading cause of death. The numbers have gone up by almost 35% since 2000. And if you look at the numbers for youth, it's alarming. We have to do better. By making this a workplace topic, we're able to touch more people with more families. And so this might not be you, it might not be your family, but it could be nieces, nephews, it could be neighbors, it could be strangers. But look at those numbers. Second leading cause of death, 10 to 14, 15 to 19, 20 to 24. And now knowing about this issue with loneliness, we have to make this a workplace topic. Nationally, 78% of suicides are male, 51% have been with firearms. It's not about gun control, it's about gun safety. So prescription medicine lockboxes, firearms lockboxes, and gun safes are two really beneficial methods. When I showed up at Lakeside Industries, I challenged the traditional thinking about safety 24/7. Most people will say, yes, we have a 24/7 culture. We believe in getting people home safe at the end of a shift. If we're truly safety 24/7, we have to focus on getting people back to work safe from home. If they're at home suffering in silence, they're more at risk. Maybe it's the financial pressures, maybe it's the relationship issues, maybe it's alcohol dependency, another substance use disorder. But we need to bring those folks back to work safe from home. And we as organizations, both labor and management, can do something about that. The member assistance program, the employee assistance program, sharing resources, having toolbox talks, doing more than a standard drug testing program is going to be a path to getting people those helps. So I don't want to spend a lot of time. We do this a lot. Happy to work with people in other situations if you want me to share additional resource. But more construction workers have been shown to die by suicide than all other workplace or occupational injuries. And so that's been alarming for people. It does beckon what Marko and Kyle talked about, that Focus 5. The numbers are mind-boggling, but in the national population, 14.2 per 100,000 people die by suicide. In construction, that number is 45.3. If we just look at males, it's closer to 50. And so you think about when I got into construction back in 1996, there were 15 workplace occupational fatalities a day. We have that in suicides. And so it's time for us to do something about it. The part that is shocking is some trades are significantly higher yet. And that points to some of those cultural factors. Maybe it points to the nature of the work, the scope of the work, where they're working, their geography, the hours that they work. There's a lot of factors that you can look at. I share this information just for people to realize that this is real. And what I've been doing during COVID is reaching out to as many of these top 10, 11 organizations and offering support, offering resources, offering to do webinars to train the management staff of labor and management to let them know that suicide can be preventable. I want to share one thing. I partnered with the governor's office here in Washington, and I partnered with the Secretary of Health. And I begged the Secretary of Health, if I help you with your agricultural industry, if I help you with the technology industry, will you assign an epidemiologist to look at the death certificates in our state and give us an example? There were 11 occupational fatalities in construction in 2018, and one of those was a suicide. In March of 2019, the Secretary of Health's office shared that there were 77 construction suicides, so identified as construction tradespersons. Some of those were active workers, some were retired workers. And then 6 months, almost 9 months later, they restated the data as 125. And so a lot of people across the country said, Cal, what's the data in my state? It doesn't exist in most states. That took a special request. We've gone to other states and we've done freedom of information requests. They're not keeping this data. And so I want you to know, don't wait for the data. Take our example of a really robust construction economy that Seattle has had and just extrapolate with some of the numbers that do exist. So this information will be available to you. What I've tried to do is boil it down, those industry factors, company and job stressor factors, and then worker lifestyle. If we had more time, I would cover a lot of those. You'll see under industry, we did have some of those factors already identified in Marko's part of the presentation. But I want you to realize stress is manifest differently in different people. So Kyle gave you some really good, useful frameworks on that PTSD and talking about the stress cycle. But there can be different physical signs, the psychosocial signs, which I listed here as psychological, and the behavioral signs. Anytime you see a change in behavior, you see a change in tempo, you see a change in attitude, you can know that there are issues under the hard hat. And the gray matter matters. So we need to think about brain health, and we need to think about how can we reach those folks to keep them safe on the job. I always like to share good news. And so one piece of good news, we started this initiative, Lakeside Industries. There was one company that had baked in mental health and suicide at that point, an industrial contractor in Colorado called RK. And then we said, we want to support what you're doing. And he said, I don't want to, do a whole lot more right now. So go for it. And I wanted you to see by May of 2016, Forbes.com, a business publication, said what construction workers could teach other industries about mental health awareness. It's amazing what our industry has done. Those 2 stand downs in those 2 states, 23 suicide prevention summits across the country. It's growing. One example, I'm working on that article right now on substance use. 4 years ago, I couldn't get someone to be quoted for that article. I had 6 people. For the next article I have coming, I already have 5 contributors. Even very conservative leaders in our industry realize this elephant in the room needs to be talked about. And so what I'd like to do is just share this example of hope. Usually when I have 50 people or more on a call, I'll hear from people later that they were glad I shared this. Sometimes the stigma of mental health is that people are weak or they're selfish when they think about taking their life. And I tell people, then you don't know Kevin Hines, because he's neither selfish nor weak. He survived a jump almost 20 years ago from the Golden Gate Bridge, and one of less than 1% of people to survive. He's got a full-length feature film. He's got a book called Cracked But Not Broken. And on that website, the Kevin Hines story, there's one 5-minute video, and he's got a couple hundred videos available. When I share this and I ask people, share this with anyone in your circle of influence that you're concerned about, good things happen. People go and get help. They recognize they're not alone. Kevin does more to break stigma than anyone else I know. Another resource that's worked really well, it's called Man Therapy. It's a free website. I've got it listed there, mantherapy.org. It uses humor to break stigma. And there's some really good videos available. And it's something that people are building into video toolbox talks. So I'd like people just to do this poll real quickly. Are you aware of the Construction Industry Alliance for Suicide Prevention website? And we'd really like to have your responses, please. What's important about this group started in October of 2016. And the CIASP has great resources available. So I know Todd and Alex are gonna circulate that, but I want people to know there's a whole host of resources on the website. There are free downloadable posters, there's articles, there's some white papers, there's mental health anonymous screenings, there's free training currently available through through July 31st. Otherwise, it's discounted training, $15 per module. This Construction Industry Alliance organization is a nonprofit, but it exists for our purposes. Those posters are English and Spanish. So I'm looking forward to seeing these results. Just so we know, we've recently done some new social media on this site. And Todd, if you have the results, we'll take them. And so 56% were not aware of that website, and 22% were. So I really want to encourage folks to go to that website. You'll see it listed here, and then I've just shared with you the various resources that are available. Only because these poll responses are so important to us, I'd like you to please respond to this poll question as well. Has your organization addressed mental health and suicide prevention with toolbox talks and training? It's got the same setup as the question Marko asked regarding substance use. Next week, I'll be doing a presentation with the AGC Virtual Safety Conference. I decided to bake the same 2 questions in so we would have a bigger chance to say, how are we doing by making toolbox talks and training available to our safety and union professionals. Kyle, anything you want to add right there? Obviously, I'm moving quickly. And Todd, if you have those results, we'll take those results. And so I think here we've got 21% toolbox talks and training. I'll say this, that's the highest answer I've seen anytime I've asked this question, I've been seeing people only doing toolbox talks. And so the fact that you've got training being done as well, I think is a really healthy sign. So I want to save time for questions. Alex, will you ask us any remaining questions? I'm just going to go through and show people the English and the Spanish signs and a couple of additional resources. And since you're sending out the slides, I think it'll be fine. You go ahead and ask us any questions that remain.
Yep, I'll go ahead and add the slides to our distribution as well. I think we pretty much answered a majority of them throughout the presentation here, and I appreciate you guys' time and doing that. One of them is, if someone commits suicide after work, who is tracking that data, or is anybody tracking it?
Well, I think based on OSHA data, there were 400 suicides known at work. And so you look at that 48,344, that percent at work is pretty low. So the tracking, I think, has been really difficult. The data, I believe, is significantly underreported. We saw that here in Washington State. Of those 125, that was based on almost 40% of those death certificates not listing a cause of death. And so everyone believes that these numbers are grossly underreported. And that's why we need to focus on the prevention side. That's why we need to focus on the education side.
Okay. Next one here is not necessarily a question, but it's something we could briefly talk on. One of the comments I remember from one of your presentations is a comment about the buddy system. We need to ask our work buddy, are you doing okay? I think that's something that we all preach at all these job sites is working with a buddy and kind of getting to know that individual. So if there is something wrong, you can.
Yeah, and I appreciate that anonymous attendee highlighting that. That goes to the essence of the peer program. It goes to the essence of Safety 24/7. You know, being my brother and sister's keeper is another powerful message that I see in the labor movement, and it works really well with respect to safety. So we know today we threw a lot of information at you in 3 really important areas: behavioral health, substance use, suicide prevention. But I think we had an opportunity to address a lot of questions. We're going to have an opportunity to share more resources and view today as kind of a starting point for a dialogue. If this is new to you, reach out to Kyle, Marko, myself, and Todd and Alex. We want to thank you for the opportunity to join you for this presentation today.
Thank you.
Yep. No, like I said before, I appreciate you guys speaking on this subject. Like Kyle Zimmer said, it's time to speak about it. It's time to bring it up. It's something that a lot of contractors may have, but maybe it's kind of on the back burner. So I definitely appreciate bringing it up, and hopefully this message gets across not only to everybody on the call, but they take it and they spread it throughout their companies as well. So once again, I will provide the poll results and the resources that these guys spoke to throughout this in our follow-up. And if you guys have any questions, I'll hold it open here for a couple more minutes to see if there's any questions that roll in.
I felt bad, Alex. I tried to mark a question that we would talk about it, and then it disappeared. So then I did respond online. So for that anonymous person who did ask that question about COVID, I tried to provide as thoughtful a response as I could.
So I will send a reminder to anybody left on the call. We do have an upcoming webinar with one of our legacy partners, Milwaukee Tool. It's called Help Wanted, Recruit and Retrain Your Future. That'll be on Tuesday, July 21st at 2 p.m. You'll be able to register for that webinar as well.
Someone did comment about the AGC of Missouri. They've done a lot. They've got a great website as well. with respect to sharing toolbox talks. I would say they've definitely been a leading chapter in that organization also. And Marko and Kyle, sounds like you guys had an opportunity to get through the questions as well.
Yeah, punched in information where we could.
Outstanding. Thank you.
All right.
Cal, thank you so much for putting this together. Alex, thank you for hosting us and inviting us to participate. It's an awesome opportunity. And certainly I welcome anybody and everybody to contact us for any further guidance or information that we can provide, and just keep educating ourselves.
Absolutely. Just remember the toughest question to ask is the first question. And, you know,
well said.
You just need to get comfortable doing the uncomfortable, and you'll see some great success stories. Thank you all.
Thanks,
Thank you,
everyone.
Thank you.
Take care, everyone.